Bismillah Rahman Rahim. So I have already gone through the strokes of anterior circulation. So let's discuss a little bit about the neuroanatomy, and let's discuss that when circulation of a specific lobe is impaired. So what will be the manifestations of that? So we have got this simple diagram here. Right. So this one on the lateral aspect we have got this lateral sulcus, right? And in the center we have got this one. This is the central sulcus, right? So what I'm drawing here is the central sulcus, right? Right. So, and in the occipital cortex, so this one is occipital lobe. So in the occipital cortex we have got this one. This sulcus is called as the calcarine sulcus, right? Right. So okay, if we draw an imaginary line to this lobe, and we descend this central sulcus to the lateral sulcus, so we can get this lobe that is called as parietal lobe. And if we just draw an imaginary line from calcarine sulcus to this notch is called as pre-occipital notch, right? So this will be occipital lobe, right? And this area is called temporal lobe, and we have got this one frontal lobe. So this is just a simple division, right, to landmark these lobes. So okay, so let me draw another sulcus that is called as precentral sulcus, right? So here we will have this precentral sulcus, right? And this one is called as the post central sulcus, right? So this area, behind the central sulcus, we will have this area that is called as the Brodmann area 3, 1 and 2, right? So we have got these three Brodmann areas, and this is called as this primary somatosensory cortex, right? So we call this as primary somatosensory cortex, right? And obviously when there is primary somatosensory cortex, we will have the secondary somatosensory cortex, also called as the association cortex. So this will be in parietal lobe. So we have got two Brodmann areas, that is Brodmann areas 5 and Brodmann area 7. So both of these are called as the secondary somatosensory cortex, right? Okay. Once we have the somatosensory cortex, we will have the motor cortex as well. So we have got this area anterior to this central sulcus, right? So let me okay, we have got this area that is called as primary motor cortex, right? So Brodmann area 4, that is called as primary motor cortex, right? And anterior to that we will have this another area that is called as Brodmann area 6, right? So this will be called as premotor area, right? So this is premotor cortex, right? So we'll have three gyri here: superior, middle and inferior gyri, right? Frontal gyrus. So this one is called as superior frontal gyrus, this is called as middle frontal gyrus, and this is called as inferior frontal gyrus, right? And okay, so we have this area 9, 10 and 11. These are three Brodmann areas. So these are called as the prefrontal cortex, right? So I'm going to discuss the features of each lobe, and I will let you know the manifestations when the blood supply is hampered. So what will be manifestations of each lobe? So I'm going to discuss that. So let's discuss a little bit basics about the neuroanatomy first, right? So this is the prefrontal cortex, right? Brodmann area 9, 10 and 11. And in inferior frontal gyrus, we will have, on the posterior aspect, we will have this area that is called as the frontal eye field, Brodmann area 8, right? So this is called as the frontal eye field, right? That is responsible for the lateral conjugate gaze, right? And if we draw an imaginary line here, so just on the lateral aspect, so we'll have this anterior ramus, right? And then we'll have this ascending ramus, right? So between these ascending and anterior ramus, we will have this area that is called as Brodmann area 44 and 45, right? So basically this area, Brodmann area 44 and 45, this is called as the Broca's area, right? So we have this area, this is called as Broca's area, right? So this is also known as motor speech area, right? Motor speech area, also known as expressive area, right? So all right, so that's about the frontal lobe, right? So we will have in the frontal lobe we will have this prefrontal cortex, premotor area, all right, frontal eye field, and the Broca's area. So we have these areas in the frontal lobe. So that's about the frontal lobe. So now let's talk about temporal lobe. So we'll have this superior and inferior temporal sulcus, and we'll have the superior frontal superior temporal, right? So we'll have this superior temporal gyrus, then we'll have middle temporal gyrus, right? And then we'll have inferior temporal gyrus, right? So in superior temporal gyrus, on this area, so we'll have this one area that is called as Brodmann area 41 and 42, right? So we'll have this one 41 and 42 areas, right? So this area is called as the 41-42 Brodmann areas, called as primary auditory cortex. So obviously the rest middle and inferior temporal gyrus, both of these are gonna called as the secondary auditory cortex, right? Or association auditory cortex, right? So we'll have another area in the posterior part of the superior temporal gyrus, right? And inferior part of the inferior parietal lobule. So this area is called as the Brodmann area 22, right? So this Brodmann area 22 is called as the Wernicke's area, right? Also known as non-expressive area, also known as the sensory speech area, right? So both of these are connected with the Broca's area, and Wernicke's area are connected with the help of a fasciculus, and this is called as the arcuate fasciculus, right? So both of these are connected with the help of arcuate fasciculus, right? So this was the secondary somatosensory cortex, right? Also called as the superior parietal lobule, right? And inferior to that we'll have two areas. One is called as Brodmann area 39, another one is called as Brodmann area 40, right? So these are called as the inferior parietal lobule, right? So this is called as the inferior parietal lobule, and damage to these can lead to Gerstmann syndrome. We're going to discuss subsequently, right? And in the occipital lobe we'll have like these areas, Brodmann areas 17, 18 and 19. So 17, 18 and 19, right? So 17 is called as the primary visual cortex, right? And 18 and 19 are called as visual association cortex, right? Or also called as the secondary visual cortex, right? So on the temporal lobe we'll have this area on the medial aspect, right? So this area will be called as the Brodmann area 35, right? So this is the olfactory cortex, olfactory cortex, right? And right, so olfactory cortex, right, Brodmann area 35. And on the medial aspect of temporal lobe, we will have another important area that is responsible for our short-term memory. We'll have this hippocampus, right? Hippocampus, right? So this will be responsible for our short-term memory, right? So I think I have covered most of the areas. So let me highlight these areas, right? So this one is called as this area is called as the frontal lobe, right? So this is considered in the frontal lobe. So what I have highlighted in the yellow, so this is the frontal lobe, right? So 9, 10 and 11 prefrontal cortex involved, right? So Brodmann area 8 is, that is frontal eye field, is in frontal lobe. The Broca's area, also called as the motor speech area, that is also considered in the frontal lobe. We have the motor cortex, that is also considered in the frontal lobe, right? So this area is all frontal lobe, right? So what I have highlighted green, so this area is all temporal lobe. So let me highlight this area. This is all temporal lobe, right? So this area, this is called as temporal lobe, right? So let me, so temporal lobe will include the superior temporal gyrus, middle and inferior temporal gyrus. Brodmann area 41, 42, that is called as primary auditory cortex, right? And the hippocampal area, right? On the medial aspect, we'll have the olfactory area, that is called as olfactory cortex, right? So and the another one is Brodmann area 22, right? That is also called as the Wernicke's area. So let me highlight these areas as well, right? So we'll have this olfactory cortex, right? And then we'll have the hippocampus, then we'll have the primary auditory cortex and Wernicke's area, right? So these are considered in the temporal lobe. Okay, let me highlight the frontal areas. So prefrontal cortex, right? So this is considered pre-motor cortex, primary motor cortex, right? And the frontal eye field, right? So and also the Broca's area. So these are areas of the frontal lobe. Okay, let me highlight, right? So we have this area is called as the parietal lobe. So parietal lobe has this primary somatosensory cortex, right? And then we have this area that is called as superior parietal lobule, right? This is also called as secondary somatosensory cortex. And then we'll have this supramarginal gyrus, and this area, this is called as inferior parietal lobule. This is also called as the we have the two areas. Sorry, so it was the right, so this is inferior parietal lobule, right? So this is the secondary somatosensory cortex. Then we'll have this primary somatosensory cortex, right? So we'll have this superior parietal lobule and inferior parietal lobule, right? Okay, let me right, so this one 17, 18 and 19, we'll have this one, the occipital cortex, right? So there are many other areas, just to highlight these areas or main areas. So we're going to discuss each of these. So let's discuss about the prefrontal cortex. What are the functions of prefrontal cortex, right? So I have one mnemonic here that is called as the package, PACOJ, right? So frontal lobe is responsible for the P stands for, so let me okay, so P stands for the problem solving behavior, right? A stands for the abstract thinking, right? C stands for concentration, right? O stands for orientation, and J stands for judgment, right? So these are the functions of the frontal lobe, right? The prefrontal cortex, that is basically Brahman area 9, 10, and 11, right? So a part of the other areas that are, we have got the frontal eye field, then we'll have the premotor cortex, then we'll have the primary motor cortex, and also we'll have the Broca's area. So a part of those we have the another mnemonic for prefrontal cortex, that is package, right? PACOG. So its functions are mainly problem solving behavior, abstract thinking, concentration, orientation, and judgment. And damage to this area, this is gonna cause the Finney's gaze syndrome, right? So this is gonna cause Finney's gaze syndrome, right? Okay. When there's damage to Broca's area, I'm just highlighting these points because most of these areas, so let me draw a demarcation line here, right? So that, okay, so almost this area, right, this area is supplied by the MCA territory. We know that middle cerebral artery is arise from here, this area, this is the lateral sulcus, right? And then we'll have the superior vein and inferior vein, and we will have the further branches of that, right? That are gonna supply. So when there is superior vein, when there is embolus, or when there is blockage of superior vein, so we'll have the stroke, and we'll have manifestations related to these cortex. If we just clinically evaluate these patients, so we can guess that which area is involved, right, without having any CT MRI, right? So, and the rest of this area, right, that is supplied by the anterior cerebral arteries, right? So we'll have anterior cerebral artery running like that, and this is going medially, and this is going to supply the rest of the areas. And then we'll have the posterior circulation, posterior cerebral artery, that is also going to supply the occipital cortex like that, right? So okay, so that's all about the frontal cortex, prefrontal cortex. Once it get damaged, so this is gonna cause the Finney's gaze syndrome. Okay, so I'm gonna discuss this the other manifestations subsequently, right? So that's all for today.